Talk about hepatitis and liver diseases. The liver is a powerhouse organ. It metabolizes drugs, produces bile, stores essential nutrients, and synthesizes proteins like albumin and clotting factors. When the liver isn't working properly, everything from digestion to drug metabolism can go haywire. First, let's start with hepatitis. Hepatitis simply means inflammation of the liver. It can be caused by viruses, alcohol, certain drugs, or even autoimmune conditions. The most common forms are viral: hepatitis A, B, and C. Hepatitis A is usually spread through contaminated food or water. It's acute, self-limiting, and most people recover completely. Then there's hepatitis B, which is transmitted through blood and bodily fluids. It can be acute or chronic, but the good news is that there's a vaccine. For chronic cases, we treat it with medications like tenofovir, entecavir, or sometimes interferon. Hepatitis C is mainly transmitted through blood and often becomes chronic, but it's curable. Direct-acting antivirals like sofosbuvir and ledipasvir are game-changers in treating this disease. In liver disease treatment, DAA stands for direct-acting antiviral. DAAs are a class of medications specifically used to treat chronic hepatitis C virus, HCV, infection. They work by targeting specific steps in the HCV life cycle, effectively stopping the virus from replicating. These drugs have revolutionized HCV treatment, offering high cure rates with fewer side effects compared to older therapies like interferon. Starting off with NS3/4A protease inhibitors are medications ending in previr, like grazoprevir and glecaprevir. Next, we have NS5A inhibitors. These are replication complex inhibitors and end in asvir. And finally, we have NS5B inhibitors, which are polymerase inhibitors. These end in buvir, like sofosbuvir. Next, let's move on to lab tests for liver diseases. When the liver experiences a lot of wear and tear, it can lead to cirrhosis. Cirrhosis just means scarring of the liver and is usually irreversible. The most common causes are from hepatitis and alcohol use. Symptoms include the yellowing of skin and the yellowing of the whites of eyes, along with nausea, vomiting, dizziness, loss of appetite, and malaise. In liver disease and lab monitoring, AST and ALT are enzymes that help assess liver health and detect liver damage or inflammation. An increase in these labs can indicate acute liver toxicity. AST, which stands for aspartate aminotransferase, has a normal range of 10 to 40. ALT, which stands for alanine aminotransferase, has a normal range of 7 to 56. When evaluating a patient case to see if they have chronic liver disease, you want to check for an increase in AST, ALT, thios, LDH, and INR, while having a decrease in albumin. In patients with hepatic encephalopathy, you will see an increase in ammonia. When evaluating for jaundice, you will see an increase in total bilirubin. It's important for you to know which labs indicated which disease state. That way, you could assess patients when given their labs. Moving on to medications that induce liver injury. These include acetaminophen, amiodarone, isoniazid, methotrexate, nefazodone, ketoconazole, nevirapine, NRTI, propylthiouracil, and valproic acid.